And I want to take a moment to thank the public health team that worked so hard to get this data turned around so quickly. As of yesterday evening, most of the information on the dashboard is complete and correct, with each of the backlogged cases being added to the correct date it would have been reported had the state not suffered a data issue. Staff is still working on the testing numbers due to the backlog, and those will be inputted to the dashboard as quickly as the process is complete. The case information includes 1,305 total cases for Butte County. 211 of those are in isolation and infectious. 9 of those are hospitalized. And as always, a reminder that the 9 hospitalized reported are Butte County residents. Based on information received from the California Hospital Association, as of yesterday afternoon, the total number of people hospitalized with COVID positive in Butte County, so not necessarily just Butte County residents, was 17. We've also had 1,086 Butte County residents recover from COVID, and we are still reporting 8 deaths at this time. So I want to talk a little bit about reporting COVID deaths. And this is a difficult topic to discuss. When we talk about our death data, we're not talking about simply data. We are talking about individual people who have lost their lives to a virus, and we are talking about all the loved ones left behind who continue to suffer that loss. However, I do want to provide those loved ones and the public with some information regarding the data surrounding the losses. Public health does not report a death due to COVID until we receive a death certificate that lists COVID as the underlying cause of death. Depending on each situation, the time between when the individual passes away and the time the death certificate is complete varies greatly. Once a death certificate is received, someone from public health reviews it, and if there are any questions regarding the COVID being related to the cause of death, the health officer also reviews it. And the health officer will work with the medical provider to verify before reporting it as a COVID death. So with all that said, I sadly have to announce that we've recently received information regarding several more deaths due to COVID. Staff is working on the process that I just outlined, but we will likely be reporting additional deaths to our dashboard this afternoon. Moving forward, the data on deaths will be included on our website and on our dashboard, and we're taking it one step farther and adding a graph that shows lives lost to COVID by date of death. However, we will not issue a media statement for every occurrence. If there is a death in a person that's not considered to be in a high-risk category, we will issue a media statement at that time. For example, a younger person with no underlying conditions. I would like to add one more time, as much as the general population wants to see this information, and as much as we want to share this data, I hope that none of us ever loses sight of the fact that this is not simply data. These are people and lives that are changed forever due to these series of unfortunate events. Lastly, many want to know, how will the backlog data affect our 14-day case rate, which determines our status on the monitoring list? The state has assured us that they will calculate our case rate based on the date the cases should have been reported, not on the date they were received. They will go back and verify whether we should have been taken off the monitoring list, should have been taken off the monitoring list at any time during the period when the data was not being received. And that time period was approximately 2 weeks. This is important because if we should have been removed from the monitoring list, it may have allowed our schools to open for in-person classes. Unfortunately, as of last night, the state is reporting our case rate at 201.6 cases per 100,000 population. That is 2 times the amount of the state's threshold, so we do currently remain on the monitoring list. Again, they will be verifying that our case rate would not have dropped below the metric, which is 100 cases per 100,000 population, during the time of the data issue. It is unlikely that that is the case for Butte County, but they will verify that and let us know if that's different. In closing, Public Health thanks the community for your patience while we processed all of the backlog data, and we continue to send out our condolences to the families and friends who's lost loved ones to COVID. As always, stay safe, stay informed, and stay healthy. Thank you.
Good morning. I'm Jennifer McCarthy with Butte County Administration. Today I have the honor of providing you information on the Butte County Stabilization Program. On August 11th, the Butte County Board of Supervisors approved $4.9 million towards assistance to small businesses of 10 or fewer employees within Butte County. The intent of this program is to assist businesses with the impacts that have occurred as a direct result of COVID-19. The impacts from business closures include necessary changes to business models and the costs of providing safe business locations for both employees and customers have taken an enormous toll on businesses within our county. The goal of the Butte County Business Stabilization Program is to assist with funds to cover the costs of these impacts in order to help stabilize the individual business, which in turn will help stabilize our local economy. Today, I will provide you an overview of the eligible uses of funds, a summary of the program eligibility guidelines, information on how to prepare for this program when the application does become available, and finally, where to obtain information on the application itself. Again, this is not a loan program. This is a grant program for businesses with 10 or fewer employees. As of note, 86% of all Butte County businesses fall into this category. Businesses of 5 or fewer employees may apply for a $15,000 grant. Businesses of 6 to 10 employees may apply for a $25,000 grant. With a budget of $4.9 million, we anticipate being able to assist over 250 businesses. That's a great number. As I stated earlier, the purpose of these funds is to assist with the direct impacts to business as a result of COVID-19. The costs could include such things as offset for financial impacts from business closures, costs to modify business models based on the impacts of COVID-19, and costs to adhere to the state guidance related to safely operating during COVID-19. While the county's goal is to create an easily accessible program with few barriers to entry, due to the fact that the program is funded through the CARES Act dollars, there are certain requirements that the program must adhere to. When the application is available, a detailed list of qualifications will be available. Today, I'll provide you a summary of some of those qualifications. Businesses must be physically located and operating within Butte County. There needs to be a demonstrated financial need as a result of COVID-19. Again, there needs to be 10 or fewer employees, which, as I pointed out, represents 86% of all businesses within our county. There needs to be no prior assistance from the Paycheck Protection Program or the SBA Economic Injury Disaster Relief Fund. The CARES Act has a strict no duplication of benefit requirement. Therefore, if a business did receive any funding from other CARES Act programs, they become ineligible to obtain funding through the county's program. The business needs to be located within a jurisdiction that is adhering to the state guidance related to COVID-19. The business needs to attest that they will adhere to the state's guidance related to COVID-19, and they'll need to submit a business plan. And when I say a business plan, I don't mean a detailed 25-page plan I mean a one-page summary. And that summary should really detail what the business plans to do over the next 12 months to really modify their business model in order to adapt to our changing business conditions. While the Board of Supervisors approved funding for the program on August 11th, the application is not yet available. We are working diligently to complete the program guidelines, the application, and the online application portal or website. We anticipate these steps being complete and the application being open come the middle of September. So what happens next? When the application is complete and the website is live and ready to accept online applications, we promise to notify the public in many different ways. We'll be providing a press release. We'll do a press briefing similar to what we're doing today. We will post the link on the county's homepage, buttecounty.net, as well as pushing the information out through our partners at the various chambers of commerce and downtown business associations and others. If a business thinks they may be interested in this program, there are some things that they can do to start getting ready for the application process. Specifically, they can work on documentation to show that the business has been impacted by COVID-19. This can be such things as financial statements such as profit and loss statements. They can also begin to work on their one-page business plan summary. As I stated earlier, this is a simple document that will just provide an overview of how they plan to adjust their business model over the coming 12 months. Luckily, if a business needs assistance with any of these documents, the Butte College Small Business Development Center has offered their services free of charge. They can be reached at buttecollegesbdc.com. Again, the applications period is not open now. It will be open come the middle of September. There will be a 3-week window that businesses can apply for this process, and then applications will be accepted, or I should say, will be granted on a lottery basis. In closing, the county would like to thank each and every one of the businesses within the county that have been doing all that they can do during this pandemic by changing how they do business, by moving their operations outside, by turning to online ordering, embracing all that social media has to offer, and really adhering to all of the safety protocols as well. We are amazed by the business's resiliency, and we are hopeful that the Butte Business Stabilization Program will be able to assist their efforts to continue to operate and grow within Butte County. Thank you very much.
Thank you to our speakers. We're going to go ahead and start the question and answer period. Are there any questions for Danette York, Butte County Public Health Director?
Yes.
What is the status of hiring a replacement for your health officer?
So the question is, what is the status of hiring a health officer?
I was on vacation week ago, so maybe you already have.
It has happened.
Sorry.
Nope, you're good. He was offered the position. He accepted. A contract was written and presented to the Board of Supervisors yesterday, and they appointed him. He will. That's okay. Good question. And he will start next Monday, the 17th.
As far as the new deaths are concerned today that you're going to release later on this afternoon, are any of those, did any of those not have any kind of pre-existing conditions, or are any of those under the age of 50?
So the question is, the deaths that will be added to the dashboard this afternoon, were any of those not in a high-risk category? And I cannot tell you, I don't know all of the details of each one, but I believe that they were all high-risk category. Other questions?
When it comes to the hospitalization rate that the county is reporting right now, and the discrepancy between the state and county reporting only local cases in the hospital, the state reporting all of the cases that are in the hospital. I've talked to Congressman
So the question is regarding hospitalization and the number of people with COVID that are hospitalized. The discrepancy between what we report on our dashboard is Butte County residents only, and the total number hospitalized, and why we do that, correct?
Yes, ma'am.
Okay, so that is the difference, is that on our dashboard, we report the total number of Butte County residents, and that's because we want to follow how this virus is affecting Butte County and Butte County residents. Our hospitals are in an area where they operate regionally. Many people come to our hospitals from different areas, and we acknowledge that, but we only show and want to know the Butte County resident rates of how many people are totally affected by COVID. So that's the difference. However, as I mentioned today during the press conference, we do get that information on total number of hospitalizations, and I will start providing that at each press conference for people, and it is reported through state data as well, so it's always available. The reason the state reports the total hospitalization is because they are watching how the hospitals are affected, not the population.
Do you feel like that's important information though for the people of Butte County to know?
I think that both are important, and so that's why we show it one way and the state shows it the other. Yes?
I have a question on skilled nursing facilities. Can you provide an update on those numbers and maybe moved at all between patients and or staff? And is there like a threshold that they have to get for those numbers to be reported publicly?
So the question is on skilled nursing facilities and the number of people that are positive within each one and a threshold of when they're reported. So the threshold that we follow is the state threshold. And in a skilled nursing facility, it only takes one resident to test positive for it to be considered an outbreak. And we do report that to the state. We do not necessarily separate our reporting to the public on skilled nursing facilities. And I will just add that there are a few that are in the county that also have positives in staff, and only staff. That falls under the same threshold as all other businesses or events or locations. So if there's 3 positives, that constitutes an outbreak. If there's 3 positives in staff only and not residents.
I believe you said that there were 2 times the amount of cases right now when it comes to the state's threshold. How do we get this under control? So, I mean, the county is concerned, obviously, businesses are concerned out there. When we hear that number, and that never comes out today, they're going to be even more concerned. What do you do as a health department to get those numbers down, to get us off the watch list in Butte County?
So the health department cannot necessarily make the change. The population has to make the change. And what they do is the same thing that we've talked about over and over and try to institute in everyone. Follow the medications that are out there. Wash your hands, wear your face coverings, stay away from gatherings, and pay attention to where you're going. If you're in a public situation and you're within 6 feet of anyone outside of your household unit, make sure you have a face covering on, even if it's outside. Any others? Thank you.
Are there any questions for Jennifer McCarthy, Deputy Administrative Officer for Butte County? Okay. Well, that concludes our press conference. Thank you so much for joining us today. We look forward to seeing you again next week.